I'm Dr. K. I'm a psychologist at the Jagiellonian University, and I'd like to welcome to the Ab Ava podcast. Join me as we explore psychology from the ground up, delving into its scientific and practical aspects, from therapy to everyday well-being. So let's unravel the mysteries of the mind together. Let's begin. In today's episode, I want to talk a little bit about the therapy. The decision to start a therapy is never easy, and it's not always related to traumatic events or situations where we are unable to cope. Sometimes people begin therapy because they want to understand themselves better or have trouble finding meaning in life or simply want to work on their self-development and need some assistance. But regardless of the reason, the beginning is always difficult. And in fact, if you think about it, from you just step aside for a moment and think about the therapy, it's an extremely weird situation when you open up to a complete stranger. So you put yourself in a position where a therapist, a total stranger to you, is listening to your deepest fears, the greatest disasters in your life, doubts about your life choices, your relationships, and so on. And in turn, you get nothing about the therapist. Because, therapists don't say things like, oh, I've experienced the same thing. Or, well, if I were you, I would do this or I would do that. You don't get it. Well, in fact, you get more questions than answers sometimes. But to alleviate the distress related to therapy, because the first session or even a few first sessions are always related to some distress, some uncertainty. We'll go through this process and I'll try to break it into pieces here. So, before you start the first session, you need to make an appointment with the therapist, and either by calling the therapist directly or indirectly make an appointment with the receptionist. So it's a great moment right now. It's a great moment to ask about all the important things that you need to know. So it is your right to know about their experience and their education. So do not hesitate to ask about the university or college degree if this information isn't provided on their website. And don't worry that they will think that you don't trust them or something. Because from my perspective as a psychologist, if you ask questions, it means that your approach is serious and you want to be genuinely engaged in the process. So, from my perspective, it's a very good sign, meaning that our cooperation will be fair and serious from the very beginning. So, if you are someone who requires any special insights or knowledge, for example, you're a foreigner with a different cultural background, or you have a hearing or vision impairment, or you are a member of a minority group. So, for example, you're a biracial person or a transgender person, or actually anything that comes to your mind. It's good time to ask the therapist if they had previously worked with similar patients. And I don't mean to ask a therapist if they are racist or homophobic, but if you want the therapy to be effective, the person who works with you must be aware of underlying processes that may impact your overall well being. So if a therapist is completely unfamiliar with, for instance, transgender patients, they will not be able, even with the best intentions, they will not be able to provide support because of a lack of understanding of minority stress processes and social interactions related to gender minority status. And because you are paying for your sessions, you need to know if a therapist is experienced enough to help you, or at least if the therapist is willing to learn how to help you. And if you have previous experience with therapy and have some additional questions, for example, you want to know some organizational things like methods of payment or if you pay in advance, or how long before the session you should cancel it, not to be charged. All the things that you need to know before you make an appointment, this is a great time to ask these questions. Uh, well, it doesn't mean that you wouldn't get the answer over the course of the first session or even the second session. But this is a good time before you start the session. It's just good time to know everything you need to know just to avoid wasting your time and possibly your therapist's time. So assume you made an appointment and you show up at the therapist's office. So probably the first thing that would happen during the session is a short introduction of your therapist. The therapist will tell you who they are, what their background is, and possibly they will tell you about their educational experience. And something that is an absolute must have, the therapist will tell you a few words about the therapeutic methods and general therapeutic approach they work with. The therapeutic approach, or we professionally call it therapeutic or counseling modality, is the group of therapeutic methods. And there are several of them. The most popular are actually two: the psychodynamic approach and the cognitive behavioral approach. Uh, Both of these methods are well established, but they derive from different philosophical approaches or from different scientific approaches. If you had a difficult relationship with your parents or someone important in your childhood, it will possibly resonate in your current relationships with your partner or your relationship with your boss or your relationships with friends and so on. And of course, I'm using the simplest way to explain it. It's not as simple as it sounds, uh, but I want you to be aware that psychodynamic therapy requires a long time to get into the dynamics of your relationships. So generally, we can say that within psychodynamic therapy, you need to go through your childhood and formative years to understand the current relationships and the current troubles in your life. And in cognitive behavioral therapy, we believe that emotions and behaviors are interconnected, and when maladaptive reactions are reinforced, they can become ingrained patterns. So, therefore, in cognitive behavioral therapy, the focus is on addressing both emotional and behavioral patterns to replace maladaptive ones with such that are more adaptive and more constructive. And because repetitions and practice are the best way to learn the new coping skills, it is quite common to give patients homework assignments in cognitive behavioral therapy. So that when therapy is finished, the patient has actual skills to use on a daily basis and to cope better. During the first therapy session, you will probably establish the therapy goal. You'll talk about the reason for starting a therapy, your previous experience with therapists if you had them, and together with a therapist, you will discuss the goal of this particular intervention. It is a crucial step on your way because the therapy goal impacts the overall process. And sometimes setting up the goal may take longer than one session because we often meet patients who are not able to specify their goals. Sometimes it's easy. For instance, a patient wants to get rid of compulsive hand washing, or they are terrified of cats. And in this case, the therapy goal is clear from the very beginning. But there are times a patient may come because something is just wrong. You know, that something's just not right, and their relationships fall apart. Their friends turn away, and no clear reason for this emerged so far. So setting up a therapy goal is not easy and requires two or sometimes even three sessions during which therapists will talk about your you will talk with the therapist about your daily life, your family, your needs, And together you will discuss the most urgent areas to be tackled during therapy. The goal of the therapy might be very specific, but it can also be quite broad. But it shouldn't be at the same time very general. So, for instance, it's hard to assess the progress when you set up the goal, which is, I want to be happy and have a fulfilling life. Well, it's not the best goal, but you can set up a goal which is, for example, I want to establish better relationship. It's okay, or you can establish a very specific goal. I want to engage in group discussions at the university twice a week. So this is very specific type of goal. Uh, the first session is also a good moment to draft a contract between you and your therapist. It can be written, it doesn't have to be, but it can be written consent, which is signed by you and your therapist, and it covers the most important aspects of the therapy process. So the therapy contract usually covers the payment methods and the time when you can cancel the session to not be charged for this. Usually, if you don't cancel the session 72 hours earlier, you will be fully charged. But there might be some variations. It depends on the therapist, on the office, and so on. If your sessions are held online, the contract covers methods of communications, information such as who calls who, and possible actions which must be taken when the connection is poor or someone is getting chopped. In the contract, the therapists will sign that sessions are confidential and no information will be shared without your consent. If the therapist takes notes during the sessions, because some therapists need to write down information just not to interrupt your speech, and they might want to come back to this a little later. So if your therapist takes notes during the session, they must declare that they will keep them in a locked cabinet or as password protected files on their computer. And since the therapy process is very individualized, such contract may cover some additional issues that you or your therapist consider important. For example, the duration of sessions or a person who should be contacted in case of an emergency. And finally, speaking of the session duration, commonly one therapy session lasts approximately 50 minutes. However, it's not rare that the first sessions are a little longer and last, for example, an hour and a half. Because the first sessions are those during which you are getting familiar with each other. And basically, you are introducing a therapist to your whole life. So 50 minutes might be a little too short for this. Also, sometimes couple therapy is longer than 50 minutes because if you take 50 minutes and split it into two, uh, just 25 minutes is left for each person. And 25 minutes for a person is just too short to do something effective and to give each person enough space to talk about their experience and their expectations. So, couple therapy usually lasts about an hour and a half or even 2 hours. And I think these are the most important aspects that need to be known before you make an appointment with a therapist. And of course, if you have any doubts, just contact your therapist or contact reception to ask additional questions. Because remember, you are the patient, and therapy requires complete trust between you and the therapist. So if you have doubts, if you're not sure about it, If you're not certain that you're making progress or anything feels not right, ask questions and reveal it to your therapist. Don't worry that the therapist will criticize you or something. If the therapist criticizes you, it's the moment to stop therapy and find another therapist. If you have any doubts about the therapy process or progress, if you are not sure about the aim of the therapy or your life situation is changing, or for example, you lost your job and you're not able to pay for your therapy, you need to reveal it to the therapist because it may impact your it may impact the whole therapeutic process. So you need to be honest with your therapist because being honest is the only way to make this whole process effective. Okay, so I guess that's it for today. I hope this is gonna be helpful for you at least a little bit. And take care. And until next time, thank you.